My name is Dr. Michelle Julian, and I'm the department chair for the undergraduate nursing program at Nova Southeastern University. Today, I'm going to discuss choosing a career in nursing. A career in nursing is grounded in serving and caring for others. Nursing allows for growth as a person and growth within the profession. One of the nice aspects of a nursing career is there are many different ways to fulfill the role of nursing. Students that obtain a nursing degree and pass their board exam can explore what type of nursing best fits their personality. Nurses work in the hospital setting, the home care setting, the clinic setting, and more. Nurses care for people of all ages, from birth to older adults. Caring for patients and their families can be very rewarding to those who like helping others. There are opportunities such as travel nursing, life flight nursing, genetic counseling, school nurses, and even military nursing. These are just to name a few. Nursing is very diverse and allows you to change your area of interest without going back to school. Advanced degrees in nursing provide opportunities to work as a nurse practitioner, a nurse educator, a nurse administrator, or a nurse researcher. Although the demand fluctuates, nurses will always be needed in the workforce. Currently, there is a shortage of nurses, and therefore nurses are in very high demand. The Bureau of Labor and Statistics projects the need for approximately 175,000 openings every year for RNs through the year 2029. Nurses' pay varies depending on the specialty area you work in or what type of facility you work in. According to Glassdoor, the average base pay in the state of Florida is approximately $58,000 per year. Nurses are usually paid hourly, and they're paid more when they work a night or evening shift. This is called shift differential. When looking at hourly pay, ZipRecruiter shows an hourly wage of approximately $26 to $37 an hour. Nurses also qualify for benefits when they work full-time, including healthcare benefits. To become a nurse, you must obtain a degree in nursing, and then you must pass an exam called the NCLEX, or the National Council Licensure Examination. To sit for the NCLEX, you must have an associate or a bachelor's degree in nursing. Research has shown that patients cared for by nurses with bachelor's degree have better patient outcomes. Therefore, many healthcare organizations prefer hiring nurses with a BSN. A BSN, or bachelor's degree in nursing, is traditionally a 4-year degree. Nursing is a wonderful career choice for those who like to serve others and have a passion for making a difference in people's lives. Nurses are highly respected and trusted in our society. This career path offers stability, flexible scheduling, and many specialty areas to choose from. Some nurses work 9 to 5, 5 days a week, while other nurses work 3 12-hour shifts each week. If you choose to work as a nurse on a surgical unit where patients go after surgery, but in a few years you want to switch what population you work with, you can work with children or even babies, and you don't have to go back to school. We hope the information that has been provided today has sparked your interest in nursing. NSU offers an undergraduate nursing degree on 3 campuses: Fort Lauderdale, Miami, and Fort Myers. Our graduates are in high demand in the South Florida area. Feel free to reach out for more information if you would like to become an NSU Shark. Thank you.
Hi, everyone. My name is Dr. Stacy Zipkowski, and I have with me here Dr. Sydney Lin, and we are both optometrists at the Nova College of Optometry. I'm an assistant professor here at Nova, and Dr. Sydney Lin is our current resident at Nova. So what is an optometrist? Well, optometrists are primary eye care providers. We examine, treat, and manage disorders and diseases of the eye. You most often think of optometry, you'll think of treating patients with glasses and contact lenses, but we do a lot of other things too. We help patients improve their focusing system and how their eyes work together in something called vision therapy. This is really similar to physical therapy for the eyes. We also treat red eyes and eye infections, and we manage disease like cataracts and glaucoma. One of the most interesting things that I learned about optometry when I first got involved was that you can actually diagnose a person with diabetes or hypertension just by looking in the back of their eye. Following this, we have a really short video of how we're able to look inside a patient's eye.
Go. Hi everyone. So here we are in our exam room. This is something called a phoropter, which we use to figure out a patient's prescription. And over here we have something called a slit lamp. Basically, it's like a microscope, so we can see in the front of the patient's eye and the back of the patient's eye.
To get into optometry school, you have to first complete your college degree, usually in the sciences. Then you have to take an entrance exam to get into optometry school called the OAT. Optometry is a 4-year degree doctoral program, but it is not medical school. After optometry school, you can choose to do a 1-year residency, just like me.
As far as typical starting salary, that really depends on where you're working in the States and what type of practice you're working in. But on average, the starting salary is between $85,000 to $140,000.
Optometrists work in a variety of settings. You can work in private practice, you can work at a hospital or community center, you can work at a university like Dr. Zubkowski and I, or you can work in a corporate setting like lens crafters. As an optometrist, you can choose to be an employee, an independent contractor, or be your own boss.
And really why we're here is why you should consider practicing optometry. So the main reason that I feel that most students become optometrists is because we really make a difference in people's lives and we help people see. It's pretty incredible when you put glasses on a person for the first time and they're able to see for the first time in their lives. That's a feeling that you don't forget. In addition, we have a really good work-life balance, and I don't believe a lot of medical doctors can say that. And we have a lot of flexibility in our schedule as far as the way our work week goes and where we can practice, like Dr. Lynn mentioned. All in all, optometry is a fantastic profession, and if you have any questions, we are more than willing to answer those for you. Thank you.
Hello, my name is Dr. Nalvlet Thompson. I'm a medical doctor specializing in the field of endocrinology, diabetes, and metabolism, otherwise known as an endocrinologist. Endocrinologists take care of patients with disorders involving the endocrine system, and I quickly wanted to show you what comprises that. The endocrine system comprises of several glands that makes hormones that works on different parts of the body. Commonly, the pancreas, which makes insulin, is the hormone that's important for managing blood sugars. And patients with diabetes are one of the most common patients that we see as endocrinologists. And usually this is because they lack insulin or they don't use it effectively. Another gland that may be familiar to you is the thyroid gland, and that makes hormones that control your metabolism. And so endocrinologists are the specialists for disorders involving the thyroid gland. Other glands include the pituitary gland, the adrenal gland, and your male and female glands, the testes and the ovaries. All are part of the endocrine system, which is the organ system that patients with diseases with this would need to see an endocrinologist like myself. I wanted to quickly tell you about my training. So most medical doctors have to go to school for several years. After high school, typically there's 4 years of college and then 4 years of medical school. Now, some schools may allow you to do that instead of 8 years, in 6 years in what's called a combined BSMD program. And many schools around the country offer that. Usually this is for students who are highly motivated, who have taken a lot of AP classes or prerequisites early on, so they come in to college much more prepared and may be able to handle the rigor of an accelerated program. After medical school, when you get your MD, but you really aren't a doctor because you don't have the experience of one, then one must go through what's called specialty training. And that usually is between 3 and 5 years, depending on your area of specialization. That they then be followed by subspecialty training, which is another 3 or so 2 or 3 years, depending on your field of interest, and also whether or not that requires a research. I'm a graduate of an HBCU, Howard University, and Howard University College of Medicine. And they also offer a combined BSMD program, which I was able to take advantage of. I subsequently did my training in internal medicine at Jackson Memorial Hospital, University of Miami, and then followed that with my subspecialty training in endocrinology, diabetes, and metabolism. After training, one may choose to go into private practice or teach or do research, and there's so many opportunities to follow your dreams and basically find what your passion is all about. My typical day now comprises of seeing patients with the various endocrine diseases I mentioned earlier, most common of which is diabetes. These patients need to be taught how to take their medications, how to live effectively with their diabetes in terms of lifestyle changes, and they may also need to be taught how to do insulins, whether with an injection, a syringe, or with insulin pens. And many of our patients are wearing insulin pumps. These are devices that deliver the insulin that they may not make adequately or make at all, but that is essential for managing their diabetes. Many of our patients learn to test their blood sugars, and they need to be taught this. To effectively take care of my patients with diabetes, I do use the service of other providers, including nutritionists, diabetic educators, sometimes exercise physiologists, which are all part of making sure that our patients are equipped with the tools they need to take care of themselves. Other endocrine disorders I mentioned earlier include the thyroid disorders, and this is a model of the thyroid gland. This is a normal model. Patients may have an enlarged thyroid. They may have a growth on their thyroid. These are all conditions that I would take care of. Patients with bone diseases, disorders such as osteoporosis or calcium disorders that may deplete their bones. These are all other conditions that I take care of as an endocrinologist. My typical day involves meeting with patients, whether new patients referred to me or follow-up patients, to see how they're doing with their various endocrine disorders. I also teach and mentor interns and residents in internal medicine who are learning about my specialty. Whether or not they choose to go in that, they do need to know about this, because in general internal medicine they will encounter patients with various endocrine disorders. And so as part of the internal medicine program of University of Miami at Holy Cross Hospital, I do teach junior doctors and make sure that they are learning how to manage or recognize patients with endocrine disorders. Additionally, I do provide consultative services in endocrinology at the hospital for hospitalized patients who may have various endocrine problems, whether they came in the hospital with that or they just happen to have a problem that needs my help while they were admitted for something else. So the variety of ways of seeing patients, there are also clinics that one may go to that may have a more 9-to-5 schedule, or typically a longer day when you have your private practice and then also have to see hospitalized patients. I mentioned earlier the many years of training that it requires to become a doctor of medicine. During your training, during the postgraduate training of internship and residency, you do get paid for this time, even though you're learning and also providing a service to whatever hospital that you're getting your training from. Salaries for interns and residents usually depend on the area of specialization, whether internal medicine or surgery or pediatrics. But it also depends on geography, in the sense of some areas, for example, of the country in the Northeast versus in the South, there are differences that may be geographical. Typically for the 2020, I think it was estimated between $40,000 and $70,000 that an average internal resident may make, which may sound like a lot, but if you think of all the loans that many of these students had to take out to complete their training and their living expenses, you know, it's sufficient depending on where you are and whether or not you have a family to support, but it's not a whole lot when you look at the bigger picture. After the income that one gets after training is more commensurate with what you're now earning once you have developed the skills to actually work as a practicing physician. And that again will vary depending on your area of specialization and to some degree geography. You will find that physicians who are more such as surgical specialties tend to earn much more than say a pediatrician or a general family practice doctor. Again, you pursue what is important to you, what you're passionate about. Salaries may range anywhere from $200,000 up to as much as $500,000, depending on, again, how involved your specialization is and the skills that's required. Some involve a lot of invasive procedures that are very risky, and so you could see why there may be more compensation to be seen in those areas. At the end of the day, don't hesitate to dream big and pursue your passion and what gives you joy. Just remember, it will take lots of work and commitment to make all of that a reality. Don't settle for any less than your best, and most importantly, enjoy what you do. Wish you all the best of luck in your future endeavors.